Okay, let's come to another very frequently encountered equipment in ICU. Today we're going to talk about nasogastric tube, NG tubes, orogastric tubes, OG tube. From their name, look at this picture. This is a nasogastric tube. A tube comes through the nose to the esophagus and sits in the stomach. In the stomach there is the pylorus, so it can be pre-pylorus or post-pylorus. The distal the tip, the less risk of aspiration. Remember, aspiration risk is never eliminated. So patient, yes, still can aspirate with an OG or NG tube, but the distal, the less the risk. As you see, if it comes here in the duodenum, it's called nasoduodenal tube, and if ends in the jejunum, it's called nasojejunal tube. Of course, the risk of aspiration here is the least, and it's less in nasoduodenal, and it's more in nasogastric tube, pre-pylorus more than post-pylorus. I cannot recall when was the last time we used nasoduodenal or jejunal tube. We mainly use nasogastric tube or orogastric tubes. Just quickly, the nasoduodenal or nasojejunal, it's mainly used if you have problem gastric motility or chronic vomiting or very high risk of aspiration. But in ICU, 99% of the time you will be encountering either nasogastric or orogastric tube. The orogastric tube you will see it probably only in ICU. You won't see it on the wards because the patient has to be sedated. So we mainly use the OG tube in mechanically ventilated patients because they are on sedation, and we'll come to that when we come to that part in ICU crash course. So you cannot use it in an alert patient. It's so uncomfortable to put in somebody who's awake a tube down their mouth into the stomach. So in alert patient we use only NG tube, while in sedated we can use either OG or NG. Technically in sedated, so NG tube or OG tube, but technically it's easier to put an OG tube. That's why in our ICU most of intubated patients on sedation, they have OG tube because it's easier to place and the patient is sedated. So also another way to get to the stomach is to go percutaneously directly into the stomach. This is what we call a G tube or pig tube, which means percutaneous endoscopic gastrostomy tube, and from its name it's directly placed into the stomach through the skin. There is also jejunostomy tubes that goes directly into the jejunum through the skin, or sometimes they pierce the stomach and then put a tube to reach the jejunum. The main difference is that the NG-OG tubes, these are short terms. We don't leave them more than 2 weeks. So OG tube plus NG tubes, short terms. While long terms, those are the PEG tube and J tube, jejunostomy tube. Also, these NG and OG tube mainly placed, at least in our hospital, by nurses, but some other hospitals by residents or physicians in general, while PEG tube and J tube require usually general surgery, especially J tube. PEG tube can be placed by general surgery or GI, gastroenterology, or interventional radiology, while J tube I think mainly by general surgery. So remember, NG, OG, they are short term. Don't use them more than 2 weeks, because the problem that come with them, especially here at the nose, you may cause necrosis and some some necrosis to the skin or gangrene or wounds. I've seen this happens, especially the longer we keep it there.